Which part of the humerus articulates with the scapula to form the shoulder joint? A. Greater tuberosity. B. Capitulum. C. Humeral head. D. Trochlea. Answer: C. Humeral head. Explanation: the humeral head is the rounded, ball-like structure at the proximal end of the humerus that fits into the shallow glenoid cavity of the scapula, forming the glenohumeral joint, shoulder joint. The greater tuberosity of the humerus serves as an attachment site for which muscle? A. Pectoralis major. B. Supraspinatus. C. Latissimus dorsi. D. Triceps brachii. Answer: B. Supraspinatus. Explanation: the greater tuberosity, or greater tubercle, of the humerus serves as the attachment site for the supraspinatus, infraspinatus, and teres minor muscles, all of which are part of the rotator cuff group. Which structure of the humerus can be palpated on the medial side of the elbow? A. Lateral epicondyle. B. Medial epicondyle. C. Capitulum. D. Greater tuberosity. Answer: B. Medial epicondyle. Explanation: the medial epicondyle of the humerus can be palpated on the medial side of the elbow. It is a prominent bony landmark and serves as the attachment point for several muscles of the forearm, including the flexors of the wrist and fingers. The radial groove of the humerus accommodates which of the following structures? A. Radial nerve. B. Brachial artery. C. Ulnar nerve. D. Median nerve. Answer: A. Radial nerve. Explanation: the radial groove, or spiral groove, of the humerus is a depression on the posterior surface of the humerus that accommodates the radial nerve and the deep brachial artery. The humeral trochlea articulates with which bone? A. Radius. B. Ulna. C. Scapula. D. Clavicle. Answer: B. Ulna. Explanation: the humeral trochlea is a spool-shaped structure on the distal end of the humerus that articulates with the trochlear notch of the ulna to form part of the elbow joint. This allows for the flexion and extension of the forearm. The anatomical neck of the humerus is located: A. Just below the greater tuberosity. B. Below the surgical neck. C. At the distal end of the humerus. D. At the midshaft of the humerus. Answer: A. Just below the greater tuberosity. Explanation: the anatomical neck of the humerus is located just below the head of the humerus, just beneath the greater tuberosity. It is important in shoulder joint anatomy and often referred to in discussions of shoulder fractures. The lesser tuberosity of the humerus serves as the attachment site for which muscle? A. Pectoralis major. B. Subscapularis. C. Deltoid. D. Supraspinatus. Answer: B. Subscapularis. Explanation: the lesser tuberosity, or lesser tubercle, of the humerus serves as the attachment site for the subscapularis muscle, which is one of the four rotator cuff muscles involved in shoulder movement and stabilization. Which of the following structures is found on the distal end of the humerus? A. Radial notch. B. Olecranon fossa. C. Coronoid fossa. D. All of the above. Answer: D. All of the above. Explanation: the distal end of the humerus features several structures important for articulation with the forearm bones: the olecranon fossa, coronoid fossa, and the radial notch, which accommodate the ulna and radius during elbow movement. A fracture of the surgical neck of the humerus can often result in damage to which structure? A. Axillary nerve. B. Radial nerve. C. Median nerve. D. Ulnar nerve. Answer: A. Axillary nerve. Explanation: a fracture of the surgical neck of the humerus is a common site for fractures, and it can potentially damage the axillary nerve, which supplies motor function to the deltoid and teres minor muscles and sensory input to the skin over the shoulder. The humeral shaft is located between which two landmarks? A. Greater tuberosity and lesser tuberosity. B. Surgical neck and epicondyles. C. Radial groove and olecranon fossa. D. Trochlea and capitulum. Answer: B. Surgical neck and epicondyles. Explanation: the humeral shaft lies between the surgical neck, proximal end, and the epicondyles, distal end. It is the long, cylindrical portion of the humerus. The coronoid fossa of the humerus accommodates which part of the ulna during elbow flexion? A. Olecranon process. B. Coronoid process. C. Trochlear notch. D. Radial head. Answer: B. Coronoid process. Explanation: the coronoid fossa on the humerus accommodates the coronoid process of the ulna during elbow flexion. This allows the elbow to bend without interference from the ulna. The capitulum of the humerus articulates with which bone? A. Ulna. B. Radius. C. Scapula. D. Clavicle. Answer: B. Radius. Explanation: the capitulum of the humerus is a rounded, knob-like structure on the distal end of the humerus that articulates with the head of the radius. This joint helps facilitate elbow flexion and extension as well as pronation and supination of the forearm. The humeral head is separated from the shaft by which structure? A. Surgical neck. B. Anatomical neck. C. Deltoid tuberosity. D. Greater tuberosity. Answer: A. Surgical neck. Explanation: the surgical neck of the humerus is the area just below the humeral head. It is a common site for fractures and is often differentiated from the anatomical neck, which is closer to the head of the humerus. The deltoid tuberosity is located on the A. Proximal end of the humerus. B. Distal end of the humerus. C. Lateral surface of the humeral shaft. D. Medial surface of the humeral shaft. Answer: C. Lateral surface of the humeral shaft. Explanation: the deltoid tuberosity is a roughened area on the lateral surface of the humeral shaft where the deltoid muscle attaches. This structure is crucial for the function of the deltoid during shoulder abduction. The humerus is part of which limb? A. Upper limb. B. Lower limb. C. Thorax. D. Pelvic girdle. Answer: A. Upper limb. Explanation: the humerus is the bone of the upper arm, extending from the shoulder to the elbow. It is a major component of the upper limb skeletal structure. Which of the following muscles originates from the lateral epicondyle of the humerus? A. Biceps brachii. B. Triceps brachii. C. Flexor carpi radialis. D. Extensor carpi radialis longus. Answer: D. Extensor carpi radialis longus. Explanation: the extensor carpi radialis longus muscle originates from the lateral epicondyle of the humerus. It is involved in wrist extension and radial deviation. Which part of the humerus articulates with the ulna to form the elbow joint? A. Greater tuberosity. B. Capitulum. C. Trochlea. D. Coronoid fossa. Answer: C. Trochlea. Explanation: the trochlea of the humerus articulates with the trochlear notch of the ulna to form the hinge-like elbow joint, allowing for flexion and extension of the forearm. The head of the humerus is oriented in which direction relative to the body? A. Medially and slightly posteriorly. B. Laterally and slightly anteriorly. C. Anteriorly. D. Superiorly. Answer: A. Medially and slightly posteriorly. Explanation: the head of the humerus is oriented medially and slightly posteriorly to fit into the shallow glenoid cavity of the scapula. This orientation helps provide the wide range of motion at the shoulder joint. The head of the humerus is covered by which type of cartilage? A. Elastic cartilage. B. Hyaline cartilage. C. Fibrocartilage. D. None of the above. Answer: B. Hyaline cartilage. Explanation: the head of the humerus is covered by hyaline cartilage. This smooth, slippery cartilage allows for smooth movement of the humeral head within the glenoid cavity of the scapula, reducing friction during shoulder movements. Which of the following structures is located on the distal end of the humerus? A. Greater tuberosity. B. Lateral epicondyle. C. Radial groove. D. Surgical neck. Answer: B. Lateral epicondyle. Explanation: the lateral epicondyle is located on the distal end of the humerus. It is a bony prominence on the